My guest today is Nikki Glantz. Nikki Glantz is a registered dietitian at the Eating Disorders Program at Milestones in Recovery, an inpatient rehabilitation center in Cooper City, Florida. She also maintains a part-time private practice at Milestones Cooper City campus and serves as a consultant to a local chemical dependency programs in the area, as well as Beacon in New York City. Nikki graduated from the University of Florida's Health Sciences program and has an advanced degree from Florida International University with a specialty in dietetics and nutrition. Welcome, Nikki.
Thank you. Thank you, Suzanne.
Yes. So we're talking about a really interesting and I know prevalent topic today,
Yes.
Food addiction. Let's start off with the basics. What is a food addict?
Okay, well, a food addict is someone who struggles with food, specifically highly processed foods, foods that contain sugar and flour. And typically what happens is those foods get out of control for that person and then it becomes unmanageable. So it's that.
So is food addiction considered, and we hear so much today about eating disorders, anorexia, bulimia, now we have binge eating disorder as a formal diagnosis in the DSM. Is food addiction considered an eating disorder?
Well, usually when someone's in their food addiction, when they're in their disease, what tends to happen is, like I said, the life becomes unmanageable. So they get out of control with that. At that point, they do need a formal assessment to assess do they have an eating disorder and meet the criteria for that. But typically, more often than not, the two go hand in hand, yes.
Okay, so tell us about an abstinent food plan. It sounds so interesting because I imagine one of the hardest things about recovery, and by the way, I'm recovering from an eating disorder.
Oh, okay.
So one of the hardest things about recovery from an eating disorder is the fact that you have to be engaged and need food for nutrition every day. So tell us about what an abstinent food plan is.
Okay, well, an abstinent food plan, which is what I work with my clients every day on, is clean eating, which is very simply clean eating. More specifically, it's getting the foods, sugar and flour, out of the food plan. Our belief is that sugar and flour are addictive substances, and with that knowledge, getting those out of the food plan then deems the food plan clean. We can get more specific in weighing and measuring and food amounts, but an abstinent food plan is absence of compulsive behaviors around the food and no sugar and no flour.
So when you talk about a clean food plan and sugar and flour, which is the sort of the white things, is that how?
Yes, I mean that's the general way. I get more specific with highly processed foods that contain sugar and flour. We look at the ingredients and go 4 ingredients in. So we get very specific because there's a lot of words that mean sugar and the average person do not know. Yes.
So as you talk about that, I think in the society in which we live today, how challenging, there must be a lot of challenges in trying to maintain an abstinent food plan.
Yes.
How do you do that?
It's a good question. Here's the deal. It takes planning. I would say 2 of the challenges that I can think of would be it's not as easy to grab and go, and you have to be a planner. Now, you don't have to become the ultimate planner and all the schedules written out in beautiful writing. It just needs to be that before you leave the house in the morning, you have some kind of plan as where your meals are going to be, if you're going to grab or pack your meals. There needs to be that stuff set up before you just walk out of the house without any plan.
Right. So I'm about to ask you about what sort of skills can help a food addict manage that. So apart from planning, what are some other skills that may be helpful for them to learn?
Well, okay, I believe meal mapping is important. That's where we map out what you're going to have. Some people get a little overwhelmed by the ideas, so sometimes I work with them privately and figure out just for today, what can we do, and we work that way. So there's meal mapping, effective food shopping. So it's, people say, oh, don't go to a food store without a list. It's vital that you don't walk in without a list. So meal mapping, that, packing and prepping, knowing the times of your day that are triggers and not ending up in the kitchen at that moment. Like that's not a good time for you to be in the kitchen when you've just come home from work and you're too hungry and now you're going to make all your meals. Like, no. So mapping that out as well.
Wow. So what are some signs that someone may be struggling with food addiction?
Well, actually the American Psychiatric Association came out with a criteria of about 7 sets of what for substance dependency to determine that. If you hit 3 of those, that's considered addiction to that substance. They actually also changed the way they now include all substances that can be dependent, meet these criteria, meaning I have them here, the APA criteria for dependency, tolerance, withdrawal. That's amazing when you think about drugs and alcohol and now put sugar into the mix of that. But it's real. Tolerance, withdrawal, if you take in larger amounts than planned, You start isolating from family, friends, and activities, preoccupation with getting that substance. If you think of a drug, when you talk to someone who's a food addict, they understand when you say chasing the drug, they chase that sugar and flour. So things like that, behavior continues despite the knowledge to know not to have it and they can't help it. Those are some of the signs and symptoms.
So these are some of the signs that we typically relate to typical substance abuse.
Absolutely, it's the same ones.
So then I guess my next question is, does a food addict have to go through the same type of detox or some sort of process of taking those substances, flour and sugar, out of their diet? And what are some of the withdrawal symptoms that may happen from that?
Right, well, there is withdrawal, I will tell you. For everyone, it's a little different. Some of the common ones are headache, irritability, sleepiness, low blood sugar or drops in blood sugar. And for everyone, it's a little different. Sometimes it's 3 days, sometimes it's 3 weeks. So you don't know. And that's why one of the things that I like about our treatment center is that we deal with everyone on an individual basis and help them get through that withdrawal of the no sugar, no flour.
Okay. So then we talk about a physical component, a spiritual component, and a mental component. How does that work when trying to overcome food addiction?
Well, that's actually the whole balance of it. Where I work, we believe at Milestones, where we believe that it can't just be, listen, I'm the nutritionist, so I know I want to make sure I help the person understand the food aspect of it. And that is a big focus initially, but then it can't be single-sided. You must get in that multifaceted part where you touch on the physical. The physical would be letting go of those actual binge foods. Physically, not eating those. Mentally saying, I no longer can manage my food. I am out of control for every time I've been around the food, I can't handle it. So you mentally give that up. And then the spiritual aspect is knowing that you give up your will to a power, the care of a power greater than yourself, to who you understand that to be. And the ultimate spiritual piece would be that you continually through service give back to other people struggling. And so this ends up helping them and it helps you, so it's a win-win.
So one of the things I think of, like when I think of eating disorders today, definitely we have many more people struggling with eating disorders, but even separate from that, we have a lot of people who are engaged in disordered eating.
Yes.
As you talk about the sort of addiction of flour and sugar, even though someone may not be addicted as a food addict, there are still many of us that struggle with having this in our diet. Would you agree?
Yes, I would say that's the big, when I tell someone I'm a nutritionist specializing with people with eating disorders, that's a typical question, like, oh, I'm disordered eating. And yes, so I would say, unfortunately, the food companies out there, they call it the blissful point, the point in the food where it meets all the senses that tantalize us. And so, yes, I think people struggle with that, but there is a difference where a person who struggles with a bite or two of that is not the person who chases sugar and flour and truly gets to a place where their life is unmanageable. We have clients that have had to leave college or their marriage because they truly cannot give up the drug of sugar and flour.
Wow. So I've heard, we all know most programs are 12 steps sort of based. Yes. And so I know EDA, OA, and there is an FAA. Is there? How do those three kind of programs differentiate themselves from each other?
Yeah, it's funny, just to throw in there's another one, ABA. I mean, it's like so funny.
Which is
because
what?
Anorexics Bulimics Anonymous.
Okay.
And they, here's the bottom line for us from Milestones' point of view is 12-step based. So I will back any program that helps them stay on course with their recovery. Each one gets a little stricter with maybe one of them does a little stricter with the food plan. One plan has no snacks in between. I'm not so much of a believer in that. I just feel there's a beginning and an end to a meal. But each one is different, but I do respect that they're 12-step based, and I'll take it, for recovery purposes. So
tell us about Milestones in the program, specifically for eating disorders and food addicts.
Well, Milestones is located in Cooper City. We're lakeside. One of the things I think is so great about Milestones is that we're real world. And what I mean by that is we're not a hospital setting. You're not in a gown. You're not doing tray service with your food. We are real world. You live in an apartment. I mean, we have 24-hour on-site supervision. We have all the amenities you would normally associate with a treatment center, but you go food shopping for your own food. We do food classes. We take you through the meal mapping I spoke about. So the whole idea of our program is that your last day in treatment is very similar to your first day at home. Yes, so that's one of the things that I think makes Milestones so special, is because we really try to transition that person back into their life as a high-functioning person.
And quickly, how long is your program for?
It's usually 30-day minimum commitment. However, it can be longer if needed, and we do inpatient and outpatient.
Okay.
Yes.
So for everyone watching out there who may be struggling with food addiction, can you tell them how to get in touch with Milestones?
Absolutely. You can get in touch with us at milestonesprogram.org. That's milestonesprogram.org.
Right.
Yes.
What a great topic, Nikki. Thank you so much
My
for
pleasure.
coming on and speaking to us about that, and thank you for all the work that Milestones does.
Thank you.
Thank you.
Mm-hmm.